We continue on talking about Hospital Week leading up to this weekend's all-community health event. Saturday, May 13th from 9 to 1 at the Mason General Hospital's South Main Entrance. A lot of things for folks to see, do, and learn about this all-community health event. Some of the things are the topic of conversation here this morning on Daybreak, as I've got Tom Hornburg, Chief Information Officer, and Savanna Dominguez, Lead Clinical Analyst, in studio with me here this morning. Good morning to you both.
Good morning.
Good morning.
Thanks for coming on and talking about some of the things that you do in conjunction with Mason General Hospital. Talking tech today, and Tom, we'll start with you. I know traditionally the hospital has gotten some major awards on being one of the most wired hospitals, and that's a good testament to the community here with some great facilities. Isn't that right?
Right. It's a great way to showcase how we're using electronic medical record. You know, the staff really put in a lot of time, and our patients see the difference. Part of our vision is exceptional health. That really goes to show how we get these awards and how the staff and the public are seeing the information go through their electronic medical record.
So, Savannah, I think, was it because of the ACA, the Affordable Care Act, that all these things had to be scanned in by a certain date, and now people are able to access these things online through the patient portal?
Correct.
And how is that process working? Are people understanding and signing up for the ability to do this? And what all can you get out of the patient portal?
So, yes, we have a really, really high turnout for our patient portal.
Oh, good.
We have over 7,000 patients that are signed in and are using the portal actively. We have the ability to message your provider. You can request appointments. You can manage your children's appointments in healthcare.
Oh, wow.
You have access to all of their immunizations. You have the ability to download your information and take it to another facility.
Oh, so like if you're going on holiday or something, you can have everything on a little thumb drive.
Mm-hmm.
Heaven forbid something happens, but if you have that information there, that's got to be very helpful.
Yes.
Is that a high number, 7,000? Were you expecting it to be set up, signed in as high as quickly as it? How long has it been going on for?
The portal has been up and functional for about 3 years.
Uh-huh.
And we definitely have a higher rate of use than most other hospitals around our community.
Tom, why do you think that is, with the information, being in information technology? And I know the website is top-notch and looks really good, and you get a lot of good information. Is it just something that people have become accustomed to using?
Yeah, I think it's the new generation technology. Everybody wants information at their fingertips. This is one way we can provide that. So another way is our virtual care website.
Yeah.
So, people that are at home and they don't want to come into the facility, they can call up, they can get access to a healthcare professional without leaving home. You can do that on their phone. Everybody's tech savvy now.
Mm-hmm.
So to provide this technology to our patients, it's really been a great thing for us. So we actually are covering more than a quarter of our active patients in the portal itself. So
Wow.
That's a lot of people.
That is a lot of people.
Yeah.
And again, on the virtual clinic, kind of step me through this process. I may wake up in the morning and have a neck ache, or I'm feeling kind of bunky, so I log in and go, what?
Right. So if you have a cold, sore throat, you're waking up, you just don't want to get going on your day.
Yeah.
So we have a website. You go in there, you register, and you dial in. It takes about 30 minutes, usually a call back. So you get a healthcare professional from the University of Washington. We kind of share those resources. And then, they'll diagnose you. If you need to go to the ED, they can kind of triage that. So they can also prescribe medications for you. So you don't have to come in the facility. It's only $35. So you can see that's a real big cost savings by having to make an appointment or come in the emergency room and tie up other resources.
Yeah.
So it's a great thing for patients to do. And you can do it on your phone. You can do it on a tablet. You can do it anywhere.
So it's kind of like the FaceTime or whatever. You're able to see the person on the other side that you're talking to.
Right. It uses FaceTime or Skype.
Huh.
Yeah, and it's all secure. So, that we take a lot of pride in trying to provide the best security as possible.
was a soft open for about a year now, open to the public, and are they responding as well as the portal?
Right. So we started out with the employees about a year ago, and about 4 months ago we launched the public side, and we've seen a dramatic increase, almost double than what we saw on the employee side. So it's a real great thing for the patients.
So $35, and then I'm assuming, Savannah, that if someone logs into their patient portal, do they see the information provided for their insurance, the separate things, right? The $35 is just kind of a flat rate,
right,
versus what you would maybe see on the portal, so you know what you're getting with your insurance.
So the portal and the virtual care clinic are really two separate things.
Okay.
The portal is where you can manage your health information.
Sure.
And the virtual care clinic is where you go in and you actually get a visit with a doctor. Those two are not really connected.
Sure.
They're two separate.
Yeah.
But one thing patients need to realize, though, as you visit the virtual clinic, those records now become part of your record at Mason General. They don't go off in another portal. So we do have that information coming back in your medical record at Mason. So if you go to the Mason clinics and then you use a virtual care, those records still wind up in the same place. So they're accessed, and eventually they will go to the portal. So you'll be able to see all that information in one place.
This weekend, Saturday, May 13th, from 9 to 1, is the all-community health event at the Mason General Hospital South Main Entrance, and folks will be able to check out both of these too as well. You guys going to be on site, or some representatives to figure this out?
Yeah, I'll be on site helping assist with getting people signed into the portal. If they have any issues with navigation, if they have any questions on how they use the portal, and also registering for the virtual care clinic saves you that step for when you actually need to use the virtual care clinic.
Yeah.
So going in and getting yourself registered is a good idea.
What kind of documents would you need to bring to register?
Your health insurance information, and that's it.
That's pretty good then.
Yeah, one of the other great things about the virtual clinic is that it's covered in about 14 states. So if you're on vacation, you have a sore throat in a hotel or something like that, you can go into your same virtual clinic and get that care. So then when you come home, your doctor will be able to see those records also. So,
wow.
It's really a thing that's coming of age for our patients. I mean, it's a great technology. It's always there. It's always on. And, 24/7, we're there to help you. So
that's really cool. That's really a neat thing that is coming out there. All right, technology. Isn't it something? Tom Hornburg, Savanna Dominguez coming in today talking about Hospital Week, some of the great things that they work on, the virtual clinic, the patient portal. It's all leading up to Saturday's all-community health event. Thanks for coming on.
Thank you.
Thank you.